The Coolsculpting technology difference. So first off, I just want to make sure that you know that we are FDA cleared. There's a lot of devices out there that promise fat reduction, but they're not cleared by the FDA. We've had over 46 clinical trials, so that's very important. Clinically proven, again, like I said before, no downtime, lasting results, no anesthesia, no special diets, no needles. So literally, the second you have this procedure done, the only thing that we ask is that you maintain your weight and maintain a healthy lifestyle. We don't necessarily want you to change anything about what you're doing. Maintain what you're doing, and you're going to see the results. So how the Coolsculpting procedure works. So at the end of the day, how many of you have fat that with diet and exercise just goes nowhere? For whatever reason, you just cannot get rid of that fat. Did you? Well, it's being lessened by the day, sir. So that is the fat that we are targeting with Coolsculpting. So it's called subcutaneous fat. So the difference between that and visceral fat, subcutaneous is that pinchable, pliable fat that you can literally pinch away from your body. The Coolsculpting technology uses controlled cooling to target and kill only these fat cells. And what's important about that is that the Coolsculpting technology is only targeting fat. It's not affecting any other areas of your body or tissue. It's only targeting fat. We're killing fat cells and only fat cells. In the weeks that follow, the body naturally processes the fat and eliminates these dead fat cells. So the dead fat cells are literally excreted through your lymphatic system. So sweat, blood, urine, fecal matter, that's how we're getting rid of the fat through your body. Coolsculpting results are long-term, and as the treated fat cells are gone, they're gone for good. So what that means is when the fat cells die, they don't come back. So every time you get a Coolsculpting treatment, you see about a 20 to 25% reduction in your fat pad. So I almost kind of picture it like if you think of a lemon tree, and every time you shake that lemon tree, you've got some of the lemons falling off the tree. If we do additional sculpting on you, now you're gonna have additional lemons falling off that tree. So some people will need additional sculpting to get the result that they want. It just depends on your expectation. Did that make sense? The technology. So this is actually a very, very cute story. So we started to see the inspiration behind the Coolsculpting procedure with children back in the 70s. So in Mexico, there was a group of kids, they were about 5, 6 years old, and they had popsicles in their mouth all day long. They were trading one popsicle for another, and they constantly had it tied up against their cheek. And they noticed that they were dimpling from the cool. So basically, they noticed that the fat cells were being killed by the cold, but because they were 5, the fat would then come back, so the dimpling would disappear, because our fat cells are all set by adolescence. So this is an idea and a notion that's been around since the 70s, but it's a Harvard-based research technology that developed Coolsculpting, or Zeltique. So we can feel good. Harvard makes us all feel better. Right? Amen. Harvard makes us all feel better. God bless the Ivy League. On your treatment day, and you could attest to this. So there are different applicators that we use for different areas in the body. And literally, we're going to have an example of it now. This is the applicator. So essentially what we do, it's all but a vacuum suck that is targeted to the area, and we're going to get a tissue draw. And there's going to be controlled cooling in between the panels of that applicator that target the fat and then kill the fat cells off. So you're going to be a good person that we're going to ask some questions with. We have a live demo that we're going to show because I want to make sure that you guys all understand what this technology looks like, because it sounds conceptually hard to visualize, but once you see it, it's like, oh, that makes sense. So essentially just picture a vacuum sucking that subcutaneous fat in between the 2 cooling panels, and then we're killing the fat cells that way, distributed through your body. Your consultation and treatment day. One thing that I will say about Full Circle Health, you guys have an amazing staff here. We have people that know what they're doing. Natalie's great. We've got John, who's been doing this for a while, Dr. Schrader, who's an MD. There's a lot of people that sell the Coolsculpting procedure, Dr. Fry as well. They don't have MDs on site at all, so this is a great place to have this procedure done. They're some of the earliest adopters of the technology, and they have all of the applicators to treat every FDA-cleared area of the body. That's huge because there's a lot of places that have maybe 2 applicators, yikes, and they're treating everywhere. At the end of the day, there are specific applicators to treat certain parts of the body. So that's a very, very good feather in the hat for Full Circle Health. So what you could expect that day. So during your consultation, we're going to basically help you create an individualized treatment plan, because depending on what area bothers you the most, you're going to need a certain amount of cycles. And what we found with Zeltique and Coolsculpting is that we want to do something called treatment to transformation. So when we look at you, we look at that area as a whole. So if it's your abdomen, we'll look at your upper and lower abdomen. If it's your thighs, obviously we're looking at both outer thighs, inner thighs, wherever you'd like to be treated. And based on what your body is presenting now with fat, we determine about how many cycles you will need. And it's all definitely based on expectation level. Is that fair? And we come up with that together. So what's going to work for you guys will work for us. We just want to show you how the best results are achieved. Oh, and were you able, what would you say about the treatment? Did you have a laptop in here? Were you texting on the phone? What were you doing when you were getting your treatment? You were reading a book. Well, I think that he was reading a book. It's such a wonderful, easy treatment. You could read during it. How long does it last? This is a very, very good question because, yeah, this sounds great, but if it doesn't last, then what's the point of it? Because let's face it, this isn't a cheap procedure, but are the results going to be durable? Absolutely. Once the fat pad is reduced, it's permanently reduced. In fact, we have durability out to 5 years. So most people to get an FDA clearance, they need to show 2 to 3 years out for durability. We have 5 years, but this is a permanent fat reduction. Changes may be seen as early as 3 weeks after the treatment. The most dramatic results are going to be within the first 3 to 4 months. So your month, where are you?
I got my treatment originally on April 8th.
April 8th. Okay, great. So you're like just about in the middle of it. Like I said before, once the treated fat cells are gone, they will not come back. And like I said earlier, as long as you're maintaining your weight and your normal diet and exercise routine, your results are going to be stabilized. So at the end of the day, if you do incorporate healthy eating and exercise, you're going to see even that much more dramatic results. We just ask that you just maintain, because obviously if you're gaining weight, you're not going to really see the value of your investment. So let's look at the results. Female results. So this is what we talk about with treatment to transformation. So this is a really good example of most people to present. So you're going to hear me talk about small applicators and large applicators. So the large applicator is a gold, the small applicator is a purple. So in the case of this particular female, we went in initially, and the first session, she had a large applicator placed on her. We debulked her area, and then afterward, we went in and sculpted with the smaller applicators. Because she had a little bit more volume to get rid of, we did that first, and then after the second session, she was sculpted to look this way. So starting from there, ending there, I think that's a great treatment, that's a great result. It really depends on where your expectation level is. After the first treatment, some people may have stopped, but to get something that looks like that, that's what we're talking about with treatment to transformation. This is a very, very good treatment panel as well. So 12 weeks after the first session, this is after we were completely done with the results. 4 months is when you're going to see everything that you see of Coolsculpting. We went back in, and this is actually with somebody that lost 3.5 pounds. We did a second session of the sculpting. So again, every treatment plan is incredibly individualized. There's no one pre-package for anybody. It just depends on how your fat presents. So after we treat you initially, we ask that you come back within 30 days so we can assess you and see what needs to be additionally sculpted. And that's completely normal. Just remember that. It's not that the treatment didn't work. It's in order to get that result that you want, we may have to do additional treatment. Does that make sense? This is kind of a very, very typical case. Before going in, reducing that fat pad, reducing and debulking, and 17 weeks after the session, this is what you see you come down to. So these are 2 of the large panels placed on the upper ab and the lower ab. To be honest with you, this is somebody that was happy with their result. We still could have went in there and sculpted further if this person wanted to, but I still think that where you go from the beginning to the end, that's still a very dramatic reduction in fat. Your clothes are going to feel different. This is not a reduction in weight, but the way that you present your clothes is going to look a lot different. Again, this is very typical of what we see every day. Just those patients that, you know, through children, years, hormones, for whatever reason, they just have that abdomen heaviness and volume that is just going absolutely nowhere. And this is the one way to get rid of it. Non-invasive fat reduction. 2 large panels sculpted later with 2 smaller panels. Then we've got the flank area. I mean, I think this is a very dramatic reduction. It almost looks like a tummy tuck. 16 weeks after the second session. So again, additional sculpting was needed. Flanks or love handles. Everybody is very asymmetrical. So with these pictures, we can kind of see how most people present with a little bit more volume given the side. But at times, there may be areas where we have to retreat on one area, but not the other side. It just depends on how your volume presents. I think this is hysterical because you could tell just by the underwear selection that she's feeling very good with her results 16 weeks after the session. So I think this is a very, very good one because when people come, they normally complain about, this is called the muffin top area, as most of you know and most of you complain about. So I think that this result is actually quite nice. Come on in. Come on in. This is basically a billboard picture because these results are absolutely amazing. So before, this is somebody that's presenting with a pretty big amount of volume around the flanks or the muffin top area. 10 weeks after the first session, or after session number 1, you see a very dramatic decrease in volume in both areas. And this is another one that she's fairly asymmetrical, so we were able to sculpt and contour her beautifully to where now she's presenting volume evenly on both sides. Again, more with the flanks. Oh, for Full Circle Health is one of the first in the East Valley to have something called Cool Smooth Pro. So this is a big deal. Ooh, feather in the cap again. So this is an applicator indicated for the outer thigh, and within 75 minutes, we're able to do a reduction of any fat pocket that you have within your outer thighs. This is one of the few places, literally in the state of Arizona, that has the Cool Smooth Pro. Normally, this treatment is 2 hours. It's only 75 minutes here. So just saying, you might want to get it done here. This is the distinct pocket of fat that we're looking for when we're looking to assess the outer thigh. So many people have this. This is a very typical way of looking. This is after one single treatment with the Cool Smooth Pro. So this is what we're looking for, a very straight angle as opposed to a little bit of the saddlebag. That's what we're treating with it.
Can you do more on that? Can you scope it down further?
You know what? It's absolutely based on, that's a great question. It's all expectation level. It's all expectation. There's some people that just depending on what their look is that they're going for, they're happy. You could. I can see a room for possibly doing a little bit more on that side. A little bit more with the outer thigh area. Now, inner thigh, this is an area that especially people in Arizona want to get treated because let's face it, we live in bikinis, we have such great weather most of the time, and we show our legs so often. We're usually in shorts or bikinis or mankinis. This is an area that we see a lot of need for in Arizona. So the inner thigh area is another one that is being treated quite often. This could be treated here at Full Circle. Let's not forget about the gentleman male results. So when we talk about treating the flanks with females, that's the bra fat upper and lower. And with gentlemen, we're just looking at the lower area to treat. So seeing here 12 weeks after the first session, we devolumized this gentleman's lower abs and then went directly for the flanks because we're looking for the V shape on a gentleman. So we want to look like Dr. Schrader and Dr. Fry. This is another very good one where he's been V'd out and carved down 5 months after the second session. Great result. Devolumized right there in the lower abdomen and then 2 smaller applicators on the flanks. This is a great photo before and after. Again, devolumized within the lower, treated on the flanks. Another great picture. Large applicator absolutely takes out that volume from the lower ab. Gentlemen present in the lower abs quite often. This is another very good one about explaining the V shape. So long-lasting results, durability. 3 years after the third session, and this is with weight loss of 13 pounds, 3 years after the third session. This next one is a great picture because I don't know if you guys have heard of Grant Stevens. Grant Stevens is basically the godfather of Coolsculpting. This man has, I want to say, 10 or 12 machines in Beverly Hills, California. He's such a big believer in it. And this is him. So this is his flanks. This is 1 year after his second session. And I won't lie, he looks great. He looks absolutely great. The man is, I believe, in his 60s. So this is pretty good for a 60-year-old guy. And again, the V-shape, beautiful V-shape. He's a huge believer in Coolsculpting. He's invested a lot of time. He actually speaks for us. Looking good in the press. What good is it if it hasn't been on the Doctors, Oz, Nightline, or Today? So thank God we've been everywhere and everybody advocates for us. Like I said, FDA cleared, over 46 clinical trials. This is very well-studied technology. If you have any questions at all, please let me know because we want to make sure you feel good about it. You understand what this is. Again, non-invasive fat reduction, and you're in very good hands here. So with that, thank you so much.